Hi everyone, this is Katie from Align and Flow, and in this video I wanted to talk about what happens in a water therapy session. So there are lots of different lineages and styles of water therapists and aquatic body workers out there, each with a slightly different focus. And a bit kind of like with massage or with yoga, it's maybe a case of you finding what lineage or what therapist works best for you. So normally in an aquatic bodywork session, for me, the most important part is the pre-part, which is the check-in chat. So you'll meet the therapist, they'll ask questions maybe about what's going on for you at the moment physically, mentally, emotionally, what are you working on, what brings you to the water. So, and the answers to that can be so many. Some people just want to try something new. Some people have had, I don't know, lower back issues. Some people are pregnant. Other people have got heartache. Some people have just tried it before and think it's the most magical and addictive thing. Other people want to experience rebirthing. Some people just want to really relax. So the reasons why people come to water therapy can be really, really wide. So you'll normally have a check-in chat. No, you'll always have a check-in chat, I would hope, with your water therapist. They'll spend some time really finding out about you, connecting to you, and talking to you about your relationship with water. So I think a lot of people, certainly that I've worked with, have got some kind of issue with water. Probably maybe like 70 or 80% of people have either had a traumatic experience with water or have some kind of reservation working with water, hesitancy in the relationship with water, of fear basically. Now that could be something that's happened to them consciously, as I said. It could be something unconsciously or subconsciously. Some people have received a session and remembered that they've had the cord wrapped around the neck when they were in the womb and double checked it, and that to be true. So the body holds on to all these memories. So the good news is that if you are coming to the water with those types of things, then yes, they can be worked with so that you can feel more relaxed and comfortable with water. So it's really important that the therapist asks you all these kind of questions to find out more. And normally if you have got some kind of, say, trauma or issue with water, then it would be recommended that you'll have a few sessions. I'd say it's always good to have a few sessions anyway. So once you've had this beautiful chat, so that then you can feel safe in the water, the therapist will take you to the water, to connect with the water. So a lot of aquatic bodywork happens under the water as well, which is where really we go into a different dimension. It's very, very magical what happens in this underwater phase, shall we say. Not everyone's ready. If people have got a lot of fear of water, they might not want to do that. So there's different processes for that. So normally in the water, you'll spend some time connecting with the water, which is warm. The therapist may introduce the nose clip, so we use a nose clip in water therapy so you don't get water up your nose when you're going under, and then you can have an experiment with, are you comfortable in going under the water or not in that session. Some therapies, if you're really comfortable, they may leave the nose clip on throughout. Others, you'll start with the nose clip off, and and that will be added later. So then normally what will happen is when it's time to float, the therapist will put some floats on your legs and then invite you to float. And then your job is just to receive and relax. Some therapists will work with a water pillow, with different water props and tools to support the body as it floats, so that they can maybe work with the joints or the fascia or whatever it is that might want working on in the session. You can feel, if it's your first session, it can be quite, daunting, that floating, like, oh, what's going on? So normally it takes some people a few minutes to just really drop in and relax and go into this beautiful state of no mind. And then depending on the particular lineage that you're with, or the practitioner, they'll make some movements and invitations for your body to create space, to expand, to flow. I've just got a big release in my shoulders as I've done that. And then at some point into the session, they may introduce the nose clip if that's something that you're going to be working with in that session. And then they may begin the underwater. So the underwater, there's different systems of communication as well. So some systems follow your breath, so that they'll always take you underwater on the exhale, which means you can never get water in your mouth. Other systems work with a sign, which will be communicated before. And then you begin the underwater work, which tends to be extremely profound. It's like being in a different dimension. So after the underwater session, they might bring you into another section of above water, where again you're just like floating. They may reintroduce the water pillow, and normally the session will finish with some grounding, bringing you back into your body, and then the therapist will bring you upright and just allow some time for the blood to go back into wherever it needs to go. And so that's generally what may happen in a water session. Thank you for listening.